Hey everyone, so today we're going to be doing USMLE Step 1 and 2 mock question of the day number 7. So as usual, we're going to be starting with a patient presentation. So a 35-year-old female with a recent diagnosis of major depressive disorder presents to the clinic for follow-up. Roughly 3 weeks ago, she was started on fluoxetine, given a 1-month history of depression, decreased hunger and energy, poor concentration, and insomnia. Today, she reports increased energy and appetite, but states that her depression hasn't gotten any better. She denies any suicidal ideation and asks whether she may benefit from an alternative medication. What is the most appropriate next step in management? So the options for this patient include either you can prescribe paroxetine, continue her current regimen of fluoxetine, prescribe venlafaxine, or start this patient on amitriptyline. So essentially, you can either continue fluoxetine or prescribe a different medication. So why don't you take a second to pause this question if you need more time? So the correct answer in this situation is you want to continue the fluoxetine. So let's back up for a second. So it's pretty clear, especially from this question stem, that this patient, about 3 weeks ago when they initially presented to clinic, they met all the criteria for major depressive disorder. And for that, you want to remember that patients need at least 5 out of the 9 of the SIGI caps. Just remember, read up on the mnemonic if you don't remember. As long as patients have 5 out of those 9 clinical symptoms, that counts as major depressive disorder. And so in our case, our patient had 5 of those, which included depression, decreased hunger and energy, poor concentration, and insomnia. So about 3 weeks ago, this patient started on fluoxetine. Now, in this situation, you might be wondering, given the fact that it's already been 3 weeks, might it be a good idea to start a different medication? But what you have to remember is adequate duration for SSRI trial is considered 4 to 6 weeks. Given the fact that this patient has only been on fluoxetine and SSRI for only 3 weeks, what we want to do is just continue the patient on the current regimen of the fluoxetine. So that's why it's incorrect that's why the rest of the option choices, including prescribing paroxetine, venlafaxine, and amitriptyline are incorrect because this patient hasn't yet had adequate trial of their current SSRI. And one thing I'll also mention is the last option choice, which is prescribe amitriptyline. That's very unlikely to be correct in any situation where a patient has depression. Amitriptyline has associated with a host of very serious medical side effects. So it's typically one of the last lines of medications you want to use for a patient who does have major depressive disorder. Typically, you're going to be using an SSRI, SNRI, one of those medications. So over the next 2 slides, I just want to go over some very critical basics that you have to remember when you're dealing with any question stems that deal with SSRIs. SSRIs are one of the most commonly prescribed medications, so I'm telling you the things that I'll go over the next 2 slides are incredibly important to remember. So starting off, SSRIs are the most commonly prescribed antidepressants that work by increasing the levels of serotonin by preventing serotonin reuptake. They're the first-line medications that are used for the treatment of major depressive disorder. But it's important to remember, as we discussed in the question stem earlier, is that patients may not experience clinical improvement for 4 to 6 weeks. So if a patient comes in 1 week after starting SSRI and they haven't had any improvement, what you're going to tell that patient is, let's wait for a couple more weeks and see if you get better. SSRIs are preferred over TCAs and MAOIs in the treatment of depression, given the fact that overall they have a very safe side effect profile. A lot of patients are on SSRIs, and I think we have a lot of data in terms of their side effects, so we know that they're relatively safe medications in the vast majority of patients. Common side effects that you should try to remember for SSRIs include the fact that it can cause dry mouth, dizziness, sleep disturbances, weight gain, and sexual dysfunction. Now, if from this list of side effects you can only remember one thing, say you're short on memory space, the one thing you should remember is sexual dysfunction. And in particular, SSRIs can cause anorgasmia. That's a side effect that's very commonly tested. So if, once again, there's only one thing you can remember, just remember SSRIs are associated with sexual dysfunction, namely anorgasmia. Another important side effect that you should also try to remember is citalopram may be associated with prolonged QT interval. I've also gotten a couple of questions about that in the past as well. The SSRIs that you should know in general are citalopram, escitalopram, fluoxetine, fluvoxamine, paroxetine, and sertraline. SSRIs are also FDA approved for a variety of psychiatric disorders. We already talked about major depressive disorder, but along with that, that list also includes generalized anxiety disorder, bulimia nervosa, OCD, panic disorder, and PTSD. Another critical thing that you have to remember when you're dealing with any questions regarding SSRIs is that if a patient is on multiple medications that increase serotonin level, one of the things that can happen is serotonin syndrome, where essentially it's a state of autonomic dysfunction where patients may become very tachycardic, start sweating profusely, and so it's a very serious side effects. So the last thing I wanted to touch upon is if a patient is started on SSRIs and they go through an adequate trial for 4 to 6 weeks and they come back and they still haven't had any improvement, what do you do in that situation? So you have a couple of different options. One of the things that you can do is you can increase the dosage of the patient's SSRI. You can prescribe an alternative SSRI. So if a patient is on fluoxetine, you can consider starting them on paroxetine. And the last thing you can also consider is starting the patient on a non-SSRI antidepressant, something like a SNRI or bupropion. And I think that's going to be it for this video.